All right, hello and welcome everyone to Let's Get Vaccinated. My name is Lucky Tran and I'm the Managing Director of March for Science, and this is the show where we bring you all a healthy dose of facts and science on vaccines and public health. We have two goals of this show, and one is really to help answer all your questions and share information because knowledge is empowering, and this is how we help each other and keep each other safe. And the second goal of this show is really to help each other become great science communicators. This is so key because as the vaccines continue to roll out, our loved ones, our communities, and the people all around us have, understandably have questions. And so all of us have important roles as science advocates to play. We play vital roles in sharing critical information with our communities. So as I say this a lot, and I really think this vaccine rollout is the biggest science communication project in history. And with that, let's get started today. First of all, I do want to say that, remember, this is your show, so please leave as many questions in the comments as possible, and we will try to get around to answering them today. And if not today, we'll do it in a future episode. And please remember to subscribe to us on YouTube. Chief of Staff Isabel will drop the link, in the comments, and because this is really the best way that you can continue to participate in our community every week, and we really value your involvement. All right, so first off, I want to welcome my co-host Rachel Alter.
Hi everyone.
Hey Rachel, who is a public health organizing lead. I'm good. How are you doing?
I'm doing great.
Yeah. And how does this how do you find yourself at this moment in the pandemic? I know we're all getting fatigued, doing lots of things. What are you working on? How are you feeling?
I'm a little fatigued, actually. Today is the month since I've had my second dose of Moderna, so I'm feeling really good about that. Yeah, I'm feeling great about that. I'm currently a second-year medical student, so I have been home now since March of last year. I've been home more than I've been at school, which is crazy. And it's been a lot of Zoom. I'm sure a lot of you guys can relate. I can relate to a lot of you. It's been a rough go, but I'm really optimistic that over the next couple of months, we're going to be getting back to school.
Awesome. And we do have a special guest today as well. And I'd like to welcome to this show, Alex McDonald, a physician in California who co-founded the This Is Our Shot campaign, this amazing campaign, our friends on that campaign to build vaccine trust. How's it going, Alex? How are you doing?
I'm well. Thanks so much for having me. I've been a big fan of March for Science for a number of years now, and it's an honor to be here to chat with both of you and interact with a lot of your amazing followers in this community as well.
Yeah, absolutely. And we are such huge fans of This Is Our Shot too. Maybe you could tell us quickly, the audience, what This Is Our Shot is and what you've been up to lately.
Sure. Can you hear me? I think there's some communication issues it look like.
Yep, we can hear you, Alex.
Okay, sounds good. So This Is Our Shot is it's really a grassroots movement. Mostly started with some physicians here, my co-hosts or co-founders and I in California and Texas, and then it sort of just quickly expanded well beyond that to really anyone who's interested in helping promote health. Any kind of a health hero is what we're calling them. It can be a teacher, a parent, a friend, a physician, a pharmacist, a nurse, whoever it is. And we basically want to help elevate the voice of trusted messengers and provide good, accurate information. That's really the whole goal here behind everything we're doing is helping build vaccine trust. And that's all about individually communicating within your networks and your circles of friends and family and colleagues, whether that's, 5 people in your family or 5 million people on social media. And that's really the goal here, is to help elevate all of our voices and to have a dialogue and to have a conversation to answer people's questions, right? Because there's a lot of information and there's a lot of misinformation out there. And we're just trying to help people sort through all that. It's really pretty fun and exciting, quite frankly.
Awesome. That's so awesome. And we're so, glad you could join our show today. And, this episode, we have some huge, big news, which is really exciting. And that is a new vaccine has been approved for use.
Yay.
Vaccine.
Yeah, it's so exciting, right? From Dolly's words right there.
I
Her
never get
excitement,
to
we
go back
feel
to
it
that
as
video.
well. And yeah, so this vaccine, of course, is the Johnson & Johnson vaccine, which was approved over the weekend. And now we're starting to see these first doses roll out and vaccines going into arms, which is super exciting. And so, you know, it's a different vaccine from the others, right? So it's not an mRNA vaccine. It's based on an adenovirus, a modified adenovirus. It's one shot, which is interesting. And it doesn't need to be stored as at super freezing temperatures like the others. So, you know, lots of people have questions. It's, you know, it really is a different vaccine, but it's, you know, really effective vaccine too. So, you know, maybe we could start with you, Alex, from a physician's standpoint. You know, what does this mean for an individual who might be thinking about getting the Johnson & Johnson vaccine?
Absolutely. So I want to start by saying that the most important vaccine is the one that's physically in your arm, right? And so take whichever vaccine comes first. Some people have said, oh, should I get this one? Should I get that one? Really, at this point, just getting vaccinated is the most important piece. We're in a fight right now. We're in a race against this virus, right? There's all these mutants and variants cropping up, and the sooner we get enough people vaccinated, then we can suppress those mutants and those variants too, and really get back to some sense of normal. So I want to start by saying you should get whichever vaccine is offered to you the soonest. Now, because of the Johnson & Johnson vaccine is just one shot, and as you said, it only has to be refrigerated. It doesn't have to be like super deep freeze. The supply chain is probably going to be much easier, and is probably going to become much more available as well, folks. And it's just one shot, right? One and done. Who doesn't like that? So I think those are kind of the big pieces right now coming out of this. Obviously, lots emerging, and we're still doing research and studies and looking at this too. But it's very effective, and I recommend patients get whichever vaccine is first available to them. That's the one they should get.
And while we're talking about that cold chain, I am really excited about this one for people in more rural parts of the country and other countries as well. There are so many countries that don't have access to any of the vaccines, and part of that is because they are really hard to bring to people in more remote areas, and this is going to make that so much easier for people both in our country and in others.
Absolutely. That's such an important point. And I do want to echo both of your thoughts, really. I can't tell you how exciting it is, just a year on from really seeing this pandemic explode, that we have, 3 vaccines approved in this country. I think in our wildest dreams, coming from a scientific research background, to see that sort of go through and sort of, culminate into this point so far is, to have such 3 effective vaccines is really incredible. And you're right, Alex, is, whatever vaccine, I think the title of this show is, why you should get the Johnson & Johnson vaccine. But what we really mean is any vaccine that you have access to when it's your turn to get a shot, I think you should take it because, they're all 3 are super effective. So, yeah,
it's almost like this is our shot or something, right? I mean, where have I heard that term before? No, I'm just teasing.
I love that. So, our audience, thank you to everyone for all your questions. We had lots of really great questions, so we would love to try to answer a few of them today, because I know there's a lot of interest and excitement around this vaccine. So, we would love to sort of address some of the questions that you brought up. So first of all, we definitely come from different backgrounds. I come from a scientific background. Rachel's a medical student, but, you do lots of work in public health advocacy. And, Alex, you're a physician as well. So, we're happy to sort of apply our perspectives to them. And, this, as a disclaimer, this is not personal medical advice. We're going to talk about the public health and, research ramifications that we know of, but please consult, your personal physician if you have any personal questions. All right, so let's get going on some of the questions. So let's start with this, I guess. Michelle Carr says, what can immunocompromised patients expect with the J&J vaccine? Is there anything different? Maybe Alex, you could sort of take that on.
Sure. The At this point for the J&J vaccine, there's really no good evidence that people who are immunocompromised are at any increased risk from the vaccine itself. There is some recommendations you try to avoid if you're on any immunosuppressive therapy or medications. You try to avoid getting vaccinated within 2 weeks before or 4 weeks after the vaccine itself. That's the most recent guidelines from the CDC. We know for a fact that people who are immunocompromised are much higher risk of having severe complications from COVID-19 as well, too. So anytime I'm thinking about a medicine or a vaccine or a surgery or anything in medicine, it's kind of a pro and con. You got to balance the risks versus the potential benefits.
Right.
And at this point, even for our immunocompromised patients, the potential benefits of the J&J vaccine far outweigh any possible risks.
That's great. Related, not the same question, but Emily says that I read the J&J vaccine is better for people with allergies. Is that true? Maybe that's yours, Alex, as well. And feel free to add, Rachel, if you have anything.
Yeah, we don't really know, honestly. There was during the studies of both the Pfizer and the Moderna clinical trials, there was a slightly increased risk of anaphylaxis or severe allergic reactions. However, now that we've vaccinated, I think even in this country alone, 60 million people have gotten at least one, if not both doses of the vaccine. And the true incidence of severe allergic reactions is minuscule. I think it's in the 0.10% or
Yes.
0.1% or so, less even. So it's very, very small.
Yeah.
So really, there's no good evidence that anyone with allergic reactions or a history of that should worry about one vaccine versus another. In fact, my office mate, who's a physician, has a history of anaphylaxis, and he got an EpiPen and an inhaler and went and got his vaccine and was completely fine. So there's no real evidence for one or the other.
I can add a bit to that. So in previous vaccines, not including the COVID ones, the incidence of an anaphylactic reaction among all vaccines per shot is around 1 per 1.3 million. So that's a really, really low chance of having a reaction. I did see that there was some guidance published a couple of days ago from the CDC that if you happen to be one of those people who has had an anaphylactic reaction to the first dose of one of the mRNA shots, they do recommend going ahead with the Johnson & Johnson. You should be fine with that.
Yeah, absolutely. I think that's really important. Stepping back, actually, this is a question that I see a lot, or some variations with it. Melania on Facebook is asking us, is it true that though J&J's vax is less effective than Moderna or Pfizer, one could argue that it's been tested against the variant, so it's actually better? Do you want to jump in? I sort of have a couple of thoughts about that too. But do one of you want to sort of address that? Because this was actually, a big thing that I was worried about before, sort of as a scientist looking at these studies, looking at, efficacy rates and everyone, once that gets into the public, these are very complex scientific experiments. And once that gets into public, it sort of becomes just numbers on a sheet, and it's more complex than that, right? And so we're worried that people are looking at these numbers and saying, I'd rather take this vaccine, I'd rather take that vaccine. And Alex, as you said, they're all great, right? People should feel great about taking any one that you have access to, right?
Yeah, absolutely. So this is a really interesting point. So I think this is where sort of like sometimes the public kind of gets given a number and then everyone sort of latches onto that one number. So yeah, so a couple different points here. One is the Pfizer and the Moderna trials were done much earlier, before we had a lot of these variants coming around, right? The Johnson & Johnson vaccine trials were done later, dealing with more variants as well. So definitely a more challenging environment to kind of do these tests and measures. So that's one piece of it. Second of all, it's almost like it's one shot. It's almost more effective, right? The Pfizer and Moderna, you need two. So it's a less potent immunization per, pound for pound when you're thinking about that too. The other thing too is keeping in mind that the annual flu vaccine is generally anywhere between 40 and 70% effective. So any vaccine which prevents 70% of illness is very effective. That's the first thing. The second thing is that all three of these vaccines, Johnson & Johnson, Pfizer, and Moderna, were nearly 100% effective at eliminating severe illness and hospitalizations as well. And that's really the most important thing. We're not going to get rid of the coronavirus. We're going to suppress the coronavirus to the point where it's kind of normal background. Coronaviruses have been around for hundreds of years probably. They typically cause the common cold. We just happen to be dealing with one which causes much more severe disease. So if we can even just suppress to a mild symptoms or a mild reaction or illness versus a severe illness, that is a win in and of itself. And that itself is going to help us get out of this pandemic lockdown Zoom mode and get back to some sense of normalcy. So I think there's a couple caveats there. The main takeaway, extremely effective at preventing serious disease, which is what we're really worried about.
And if you extrapolate to, if you look at what it's like with the flu vaccine, even on a normal season, the vast majority of people who are hospitalized and who die from flu were not those who were vaccinated. So the vaccine really does work to prevent that serious illness, even if you feel a little bit icky from getting sick.
Agreed.
Yeah, absolutely. And I think we also have a similar question. Let me just find it. I think what I do want to say is that, before this all started, in terms of the numbers that we're seeing for efficacy, and then especially for preventing severe disease and hospitalization, I think if you were to poll most scientists, virologists, epidemiologists, they would say it's almost beyond our wildest dreams. Like it couldn't have gone better in having, a number of vaccines to choose from, and they all, make that mark. So they really are amazing, and science has done an amazing job. And now it's time to, all participate in helping each other, get appointments for vaccines, to talk to your family members and help everyone, get the shot. And as you say, Rachel, get the shot out to all vulnerable community members, both at home and all around the world. So it really is exciting. Go ahead, Rachel.
I just wanted to add another really cool point about the mRNA is that now that we have this technology, as new variants come up, it's going to get progressively easier and easier and easier to keep making different vaccines that fight them. So instead of, a year to produce the next one, it might take 6 months, and then it might take 100 days, and then it might take, 10 days. Who knows what the science is going to bring us, but it's going in a great direction.
Yeah, absolutely. And it's a platform, even though we sort of say it's like a year, it's been developed for years and years and years, before when we had SARS, scientists were working on it, and they were really, building up to this moment. And I feel that we are so lucky in many ways, and it's the work of many scientists over years to bring us to this point where we have such an amazing technology that we can deploy at such a crucial time in history. So, really thankful for all the hard work that everyone's putting in there. Yeah, so this question I see a lot with, this is from Victoria. Does the vaccine reduce an individual's chance of being a carrier of COVID? If so, do you have rough statistics to share? And the general question is, transmissibility. We've talked about preventing severe, disease, right? Which the vaccines are super effective on. What do we know about, being able to pass on the virus once you've got, the vaccine? And what do we have to wear masks? How long are we doing this for? I have a lot of thoughts on how this is being communicated, but there you go. But yeah, just wondering, before I just sort of jump into the science communication part, I'm wondering what, your thoughts are on that. What do we know so far?
You want to take this, Alex?
Please go ahead, by all means.
Sure. So I can start. That is a question that has been coming up a lot, and I don't think there's any definitive answer yet, but it's looking more and more like it is very likely that the vaccine is going to stop transmission as well as just disease.
Yeah, I'd agree with that. I mean, these clinical trials were not designed to measure that, right? So it's really important that we stick to the science, and we give facts when we know facts, and admit that we don't know the answer when we don't know the answer. And this is one thing we don't know, because the clinical trials weren't set up for that. Now, as Rachel's point, there is definitely some emerging evidence showing that there is probably a reduced transmissibility, asymptomatic spread. Particularly, there were some studies out of UK and Israel where they've vaccinated a much higher percentage of the population. They can do some of this research. But until we really definitively know, we got to all keep wearing masks. We got to keep washing our hands, 6 feet away from people. It's all those things that if we all do our little part, it's inconvenient. No one likes it, but it's really important. Until we know, we'd rather err on the safe side. And especially now, given, how shall I say this? Given certain politicians' catering to different whims and getting back to some sense of normal. We cannot let our foot off the gas now. We've come so far. We're seeing rates of COVID, new COVID infections come down. We're seeing hospitals unload finally and get back to some sense of normalcy. And we can't take our foot off the gas now. We got to keep doing everything we can until we can get enough people vaccinated. And we really have the evidence and the scientific knowledge to know the true answer, right?
The other point on continuing to wear masks, and I know it's really annoying. Luckily, it's a bit colder now, so it's not like it's really hot and stifling, but you can't look at somebody and know if they've been vaccinated. So until we have a big enough percentage of people, in the background who are vaccinated, and that you can say it's more likely that that person over there has been vaccinated than not, we need to all wear the mask so that we continue to put up, we don't want to make it look like it's not a problem anymore and that everybody can go do whatever they want just because you've been vaccinated. Like, nobody knows if you've been vaccinated or not. So we want to keep respecting people and doing that showing mutual respect.
Yeah, absolutely. And I think you both covered this well, but yeah, from the science communication aspect, it is, as you both have been saying, is that we want to be careful in how we communicate about it whilst we're waiting for the data to come through. But I do want to make it sort of clear, like, when scientists say we don't know, it's more that we're waiting for data. It's not a negative, it's not a no, it's being careful. And sometimes that is tricky because the way we speak and with the way we do research and the way we communicate to an academic audience might be something different that we say to our friends and family, etc. And sometimes because of the way social media works, the two get cross-pollinate and there's sort of misunderstanding. So I found it interesting talking to, the circle of friends and the community around me, that everyone was telling me, oh, it doesn't, you can still pass the virus on if you get the vaccine. And it's important to know that's not true. We're figuring things out. And the expectation is that it's going to play a significant role in getting these numbers down and preventing for the most part transmission in happening. We don't know how strong that effect will be, right? Which is why we're talking about masks and being careful. And there's a Ian McKay, who's a virologist in Australia, talks about this Swiss cheese model of protection, is that public health, there's no one size fits all. There's no one intervention that is going to save us all. I think we're strongest when we have, multiple interventions. We take multiple precautions. I think that's common sense. It makes sense for a lot of aspects of life. And this is really what we're talking about here, right?
Mm-hmm.
I'm going to strain my neck from agreeing with you.
And even if you have a 95% efficacious vaccine, there are going to be 5% of people for whom it may not work, and they've done everything right. Their immune systems just don't take for whatever reason. So until we have that high level of for herd immunity, got to keep going with the masks.
Absolutely. And another related question in science, I guess, to be determined. Cynthia asks, how long does vaccination last for? Is a shot we need to keep getting every 6 months to a year?
That's a great question. We don't know, is the short version. The longer version is, we know that when you get a sort of a natural COVID infection, or you actually get COVID, you have antibodies for about 3 months or so. So you probably have some degree of protection for 3 months. When you get the vaccine, we think it's probably closer to at least 1 year, if not 1 or 2, although we don't really know that definitively. We know the vaccine creates a better immune response than actual COVID infection itself. Time will tell. I suspect, and this is pure conjecture on my part, we are going to get our annual flu shot and biannual Q5 year COVID vaccine. That's my guess, quite frankly. But hopefully I'm wrong.
It would be amazing if it lasted forever, but you can't win everything.
No, and it's important. I know it's frustrating. I know it's like I think as a scientist, I have all these questions as well. It's like, why don't we know this yet? Why don't we know that yet? And it's literally, because of the way things are happening, we're literally learning so much about the virus and the vaccines every day. And that's just sort of part of the world that we find ourselves in. So yeah, I think these are all really great questions. So I just don't want people to be frustrated with when we're sort of, a lot of them, the answer will be, we don't know yet. And that is just science, but just because we don't know doesn't mean we're not empowered to act in a way that will help protect us us all. And the way we act right now, even though we don't know how long it will last for, we know in the short term it's a powerful tool to both, get numbers down and protect us, stop us from getting hospitalized. And so that's why there's an urgency in getting everyone vaccinated now, because it will save a lot of lives. And so I think that's really the important take home. Even if we don't know, a lot of these details down the road, I think we know enough to know that it's going to be a big help right now.
And I think too, Lucky, to your point is, science takes time, right? And I think right now, a lot of the data we know that regarding a lot of public health interventions has taken decades to know, right? To look through and to know. We've basically been compressed into this like pressure cooker of this last year, and the science is playing out in a very, very public way, right? Everyone should wear a mask. No, you shouldn't wear a mask. You should wear 2 masks, right? And it seems like we don't know what we're talking about, but that's actually the natural scientific process of asking questions and learning as we go too. So a little bit of a caveat to that degree, but I think it's important to know that science good science sometimes raises more questions than it answers, right? And that's okay. And that's part of the process. And I think the most important thing as science communicators is to be honest about that and don't make things up if we don't know the answer, and being honest about what we do know, what we don't know, and what we think we know.
Yeah, I love that. I remember the White House, when, with the new administration, the press officer went in and said, it's okay. Sometimes we're going to say we don't know something, and that's okay to say in the context of a press conference. And as a scientist, I was saying yes. And as like a press office person, I'm saying yes. So,
I would so much rather somebody tell me they don't know than lie to me.
Yeah,
I remember as a physician, the first time I was a young physician in training, and the first time I said I don't know to a patient, and that was so terrifying for me. But then the patient actually really valued that, and actually it developed a better relationship with the patient too. So if you ever see a physician and they think they know everything all the time, run screaming the other direction, quite frankly.
Yeah, even better when they say let's figure it out together.
Yep.
All right. Here's a good question: is sort of we're thinking about this amazing world. What happens after you get vaccinated? What can we do? How do we act? Right. So Bob says, do we need masks when socializing with other people who are vaccinated after we get our shot and we're fully protected? Are we at danger from unvaccinated people? What's your guidance here, both of you?
So I have asked this question a million times just to make sure that I know I'm not doing something wrong. My impression is that if you and everybody else you're seeing is vaccinated, you can be indoors and unmasked. And my family is actually going to be doing that in a couple of weeks. We've been very, very careful. I'm living currently with both of my parents. The 3 of us are fully vaccinated, and my 2 grandparents just finished their second doses a couple of weeks ago, maybe a week or 2 ago. So we've been so good all year. If we ever see my grandparents, it's outside, distanced. We'll have, bring a sandwich over and eat lunch outside on different tables. But we're going to be having them over for Passover, just the 5 of us and perhaps my brother, who will be unvaccinated at that point. But because the 5 of us have all been vaccinated, we feel that it is safe enough to have my unvaccinated brother over.
Yeah, I think that is a great point, Rachel, and it's interesting you should mention that too, because my in-laws have both received both doses of their COVID vaccines. My wife and I, who's a healthcare physician as well, have our vaccines, and it's kind of like speeding. It all depends on your risk tolerance, right? Nothing's 100% safe. If you're driving, the speed limit's 55, you're driving 55, you're probably not going to get a ticket, right? If you're driving 60, technically speeding, you're probably not going to get a ticket. If you're driving 90, you're probably going to get a ticket, right? So it all depends on the individual's risk tolerance. And again, it's a decision, risk versus benefits. Seeing your grandparents, who I have 3 young children who haven't seen their grandparents in almost 18 months now, right? And so if for each individual, it's an individual decision in terms of what is the safest thing to do. It's safest to sit at home and stay wrapped up in a bubble and never go anywhere or do anything, but that's not very high quality of life either. So it's really an individual decision for every person. That's what I say. If you have questions, encourage you to talk to your physician, and decide what works best for you and your friends and your family as well.
I'll give you another example. I've been home for a while now, and I don't actually have any friends nearby, so I've not been tempted to see anybody. But a couple of weeks ago, a high school friend of mine did come home for her vaccine. She is immunocompromised. She has Crohn's disease, and she's been really, really, really careful. She just got her first dose of Moderna, I think, a week ago. Her parents are both vaccinated. My whole family is fully vaccinated. I hadn't seen her in forever, and we decided last week she did not feel comfortable coming into my house, having only just gotten her vaccine the day before. So we went for a walk outside. We wore masks. We felt fine. This week, when she's been building immunity for a little while, she feels more comfortable with that. So I might have her over and watch a movie one night. And that is something I feel safe doing, and she feels safe doing.
Awesome. And I guess I would sort of put it, let me know if this sounds right to you, both as people sort of in medicine, I guess, right? So I think among a small group of people who, 2 or 3 maybe, like that are vaccinated and you know them well and you trust them, then yeah, I think we can. I do think it's important to start talking about this because we want to take precautions, but also, as you say, Alex, it's probably unreasonable. It's hard. We know from a sort of mental health point of view, it's hard to sort of keep doing what we're doing forever without an end. And it's true, the vaccines are amazing and they will help us end this pandemic. We got to be sensible about it, but so I feel like you can start doing stuff. If you haven't hugged your grandmother for a while and you're all vaccinated, then that's probably something to look forward to, right? And on the other hand, obviously, when you start bringing in, if you're talking about like house parties where you're thinking about everyone who is vaccinated can attend, but you're doing a party of 100 people or something like that, that's probably not a wise idea, I would say, because then it's more human nature, right? How do you enforce that, etc.? I think, keep within your trusted circles and keep them small for now, right? Whilst we're waiting for the whole population to get vaccinated. Does that sort of sound like a right sort of way of thinking about it for me? That's sort of where my headspace has been in lately.
Yeah, I would completely agree with that. I mean, in my clinic, in my hospital, I think 80% of the physicians 88% of the physicians are vaccinated at this point, but we're all still wearing masks. We're all still avoiding meetings of more than 6. We're still making sure we're physically distancing as well at those meetings. So we are still doing all those things to make sure we all stay healthy and that we can protect ourselves and our patients as well.
Yeah, that's great. So here's a communication question, which I know we're all working on this right now, which is interesting. So in terms of science communication, what can we say to friends who are declining the vaccine, saying, I never get the flu vaccine and this virus is no different. I have a healthy immune system, so I don't need to worry about COVID. What do we do, friends? I know we talk about this a lot and think about this a lot.
I like to say, you want to go?
I have a great one here. I have this conversation every single day when it comes to the flu vaccine. It's like a seatbelt. Hopefully you're not going to get into a car accident. You're going to do everything possible to avoid a car accident, but God forbid a seatbelt could save your life. A flu shot, a COVID vaccine is exactly the same thing. Hopefully you don't need it, but it could save your life.
Yeah, there's really no downside to getting it except for, maybe a day afterwards you don't feel so good. But there's no harm to doing it. And sometimes you don't know you're sick until you're sick. And by then it's too late.
Yeah, most people are spreading the virus 2 days before they even have symptoms when you're talking about a typical flu, and likely for COVID as well, the same type of time frame. So it's so important. Again, I tell people don't get vaccinated for yourself if you're not worried about yourself. Sure, young, healthy person, you may get a mild case. Do it for your grandmother, do it for your grandkids, or your nieces or nephews. Those people are much higher risk too. So vaccination is not a selfish act. Vaccination is a selfless act for your family, for your community, and I cannot stress that point enough because it takes, hence the name of our motion, this is our shot. It's going to take all of us to do our small part to really get back to some sense of normalcy.
I don't know. I do it for some selfish reasons too, because I have a really low pain tolerance. I hate even getting colds. I become like the biggest baby. So I mean, it might not kill me. I might not end up in the hospital, but I don't want to be sick. I've got a lot of stuff going on. I've got to learn medicine, and I don't want to be knocked out for a couple of days. So I'd rather just get that shot and not take the chance.
Well said. Well said.
Absolutely. And that's totally fine too. You can do both at the same time, right? There are many motivations, and they're all good motivations, right? There's, getting a shot is a fantastic thing to do, and we should all do it. So yeah, thank you for speaking about that. And I think we should wrap up this. Oh, sorry, Alex, did you have anything to add? Yeah.
I was just going to say, I think one of the most important things, and I see residents and medical students who I'm teaching do this mistake all the time, is someone doesn't want their flu shot, and then the medical student or resident launches into a tirade, or sorry, an education session about why they should get their flu shot, right? And that's the wrong thing to do. The next question is why. I don't want my flu shot. Why, right? And then you address the individual, and that's what we all need to do regarding this COVID vaccine, is address individual hesitancy and questions, right? Because one person standing on a TV screen saying something for everyone is not going to work, right? It takes individual conversations and a tailoring the message and the answering each individual's questions and concerns based on where they are in their sort of vaccine journey, so to speak. So I think, again, that's part of the mission of This Is Our Shot, and this movement is to have each of us kind of act as a trusted messenger within our sphere of influence. Again, like I said, whether it's 5 people in your family or 5 million people on social media, we all are influencers in our own way, and to address individuals' questions wherever they are in their own vaccine journey.
There are so many reasons why people are hesitant. I find one of the ones that comes up most often, something we like to say in vaccine world, is that vaccines are a victim of their own success. So say with polio or with measles, people, in our grandparents' generation, they know what polio looks like. They might have been out there waiting in the 1950s to get their shots when they first came out. And they saw the devastation that it caused. And people these days, we don't see polio. I have never seen a case of polio. I'm sure most of us haven't ever and never will. So we don't really realize what it's like. But if you go out to a hospital or, in New York, I was walking by makeshift morgues. You see that there are people out there who are dying. You see these stories of young runners, young athletes who are in the hospital, who have long COVID several months later, who still can't even walk a mile. They were running marathons before. So I think one of the biggest things that we can do right now is really, show people that people who look like them aren't always doing that well.
Yeah, absolutely. And I think that point on that, vaccines are a victim of their own success is an interesting one, right? Because we're dealing with an age where there is a lot of misinformation around science, right? And I think that a similar thing can be applied to many fields. And my one hope, and this doesn't happen on its own, it only happens if we all are science communicators, talk to our communities, and use this moment to really, help people, sort of connect them with science and help them build trust with science and sort of, and the vaccines. I think this is an opportunity for us, to do a lot of good on this, area where we've been, quite frankly, struggling with over the last few years. There's many factors with that. Social media is obviously a reason, and the politicization of a lot of things that shouldn't be politicized, possibly. But I am really hopeful that people will see how amazing this work is and how amazing the vaccines are, and the work that we all do putting in to talk to our communities, that will come out the other end a stronger world and stronger society where we're all looking after each other just a little bit more. All right.
Well said.
Sorry, you still have a landslide here.
No worries. I think thank you so much to everyone for all the amazing questions. They were really they were really great questions, weren't they? So we really appreciate it. We appreciate the interest. It's really important that we have spaces like this to talk about them, because I think we all have questions. It doesn't matter if we're a physician, we're a scientist, we're a member of the community. We all have questions about these new vaccines, and it's important to have this open dialogue in every space that we can right now. So really appreciate it. Keep them coming in. If we missed some of them, we're sorry to miss them this week. We'll try to address them in a future show, or we'll jump in the comments and answer a few more. So thank you so much for that. And with that, I want to say thank you, Alex, for joining us today. We really appreciated your perspective as someone on the front lines, and thank you so much for all your incredible work over the last year. And tell us how people can connect with This Is Our Shot.
Yeah, absolutely. This is going to take all of us. So This is our shot as a grassroots, mostly social media effort, Facebook, Instagram, and Twitter, and TikTok. We just added TikTok at
Awesome.
This Is Our Shot, and then using the hashtag This Is Our Shot. People can sign up for emails at www.thisisourshot.info and get information that way too, and sort of join the movement, join the coalition, grassroots via social media as well as kind of more formally through the website as well. So I encourage anyone who wants to be a health hero, who wants to be an ambassador for these, to get back to some sense of normal. This really is our shot.
Thank you so much, Alex. Have a great evening, and we'll see you soon.
Thanks.
Bye.
Bye-bye.
Night, everyone.
All right, and moving on to now the news, we've got a couple of other things to cover. So first of all, to completely change a different pace, someone actually asked this in the questions, and I'm just going to throw up because this happened this week, and we have feelings about it. So yeah, Greg Abbott, the governor of Texas, just announced that Texas is open 100%, everything. They also ended the statewide mask mandate. Yep. And
Not super
we have no, I think this is the appropriate reaction right here. Deserves a Fauci facepalm, right, Rachel?
Yes. Amen to that.
Yeah. So why is this a bad idea, Rachel?
Well, because people are not vaccinated yet. And because when we let down our guard and start doing things, the virus grows exponentially. So you may be low right now, but 2 people get it, and then 4 people get it, and then 8 people get it. And soon enough, you've got this huge spike again. It's unsustainable to keep yo-yoing up and down and up and down. And we really need to understand that this is a lifestyle that we're going to have to live for a little while. And things are not going to be the same as they were a year ago. They can't be. We really have to get used to this new normal. And that's going to start getting better with the vaccination, with, the more we learn, we're going to have more therapeutics soon, eventually. But we really should not be opening up right now, especially with all of, last week, whenever it was 2 weeks ago, when Texas had their weather catastrophe, and people were, living together, coming together for their heat and their electricity, and breaking the bubbles that they had before. There's so much mingling. It's not a good idea to open up right now.
Yeah, and the frustrating thing about this is that you're right, it's been a year, right? And it's not like we can claim naivety or innocence. We know what happens when we do this early. When we open up early, it puts us at risk. There's a chance that more harm will happen, the virus will spread, even if we have vaccines, right? And as we've talked about just then, no one tool is perfect. We can't just rely on one public health tool. We need all of them. And and what's also frustrating is that we see countries that are successful who are disciplined about this. They don't open up too early. When they see community spread, they make sure they take all the right precautions, whatever the right interventions are in their place, and they make sure they see it out. And by seeing out is how you get better numbers, how you protect your community. So it's incredibly frustrating to see this evidence from the past that we've experienced personally, and this evidence from countries around the world who have, COVID zero strategy and are being successful in Australia, New Zealand, Vietnam, all these other places.
New Zealand.
Yeah, I'm a little biased there, but as an Australian who's living in New York, it's a little frustrating, but yeah. You actually also made this other good point, Rachel, actually, and I saw a lot of backlash from certain social media influencers who sort of said, oh, Texas is not doing a good job on COVID. Maybe we should deny them the vaccines. Tell us why that's a terrible, terrible framing. So that's also frustrating, right?
Yeah. So one of the things that I am trying so hard to acknowledge is that vaccination is nothing but a public health tool to keep us healthy. It's not a reward for good behavior. It's not, you can't withhold a vaccine if somebody's done something quote unquote bad. That is such a dangerous mindset. Vaccines are for everybody. The worst person in the world should be vaccinated, because that person can still affect all of us. We are a global system. We travel, we breathe on each other, we see each other. you can't stay isolated. So, and also you can't blame an entire state of people for something that their governor did. That's just, it's cruel. So let's not use vaccination as a reward or punishment system.
I know there's already many things that are politicized in this way that, shouldn't be already. Let's not make vaccination another one of them, right? And, health is a human right. We have to be, that's something that is so basic, right? The WHO says, you should, have access to health regardless of, what your race is, what your religion is, what your political affiliation is. We all deserve the right to have access to health, good health. And that's another thing,
the politicization, it's a hard word to say. We don't want to politicize this vaccine. I mean, Democrats might be in the right now, but they might be in the wrong years later. And if we use this as a weapon and withhold health tools as a weapon, God, that's going to be such a bad thing for us.
Yeah. And from an organizing perspective, I do want to say, I think people really conflate things. There are, it's when we're talking about health and, things like basic human rights to needs, like, COVID relief and all of that, everyone deserves access to them. We fight for everyone. As a movement, we fight for everyone to have access to those things, that's different. And when we go into the political arena, when there's elections on, we can fight for candidates, and that's different. That's a different arena, right? We're fighting for candidates who will uplift equity and justice and science. I think that's great. But when it comes to basic needs, basic human rights, we fight for everyone. I think that's really important to understand as, we're participating in this movement and doing our advocacy. So having said that, I want to plug, we're going to drop in the chat. Thank you, Isabel, our Chief of Staff, for dropping in the chat our petition to really call on governors in Texas and whatever state you're in to not lift restrictions too early. I think it's important that governors hear from us right now. I think many people, fortunately, even with what's going on at the top, they're saying, no, I'm going to keep observing what the scientists and experts tell us to. That's fantastic. But I think our politicians need to hear from us that, there is support for keeping the public health guidelines in place. So, please, sign that petition, get in touch with, your governor, and really sort of do advocacy around this, because we collectively can save a lot of lives if we participate in this, right?
And it's just a bath. It's just a little piece of fabric over your face. It's like a tissue. It's no big deal.
Exactly. I want to wrap this up soon, but I do want to share this lovely piece of news that happened this week in a lovely little video. So I'll just play that now.
Well, hey, it's me. I'm finally going to get my vaccine. I'm so excited. And I wanted to tell everybody, I think you should get out there and do it too. I even changed one of my songs to fit the occasion. It goes, vaccine, 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 vaccine. I'm begging of you, please don't hesitate. Vaccine, 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 vaccine. 'Cause once you're dead, then that's a bit too late. I know I'm trying to be funny now, but I'm dead serious about the vaccine. So I just want to say to all of you cowards out there, don't be such a chicken squat. Get out there and get shot. Okay, here I go. All right. Think you got it?
I got it.
Okay. Hey, I did it.
Never old. I love it.
It doesn't. It's so lovely, isn't it?
I watched it like midnight last night when I was studying and just tired, and I was so happy.
I have the song in my head, and Dolly really is a national treasure. But I think she just really captured the feeling that all of us have, when we have, get vaccinated ourselves, and when our relatives or people we love get vaccinated, really. And I thought that was just a lovely piece of, communication this week, because it's nice to have good news. It's been a tough time. It's nice to have good news. And of course, as people probably know, Dolly Parton made, $1 million contribution towards the research of the Moderna vaccine, right? Which is incredible. So she has, an active role in all of this. Rachel, I think you wrote, yeah.
She even waited her turn to get it. She said that she didn't want to seem like she paid her way in, so she waited until she was eligible.
Amazing, amazing, amazing. Yeah. And I think it's really important, that people like Dolly Parton, celebs, I think you wrote an op-ed on this, right, Rachel?
I did.
Have an important role in communicating the power of vaccines.
Yeah, like it or not, this country really cares what celebrities have to say, whether they're musicians or athletes or actors, whomever. We take the word of what our celebrities say, so it really, really helps. I mean, you're gonna have your anti-vax celebrities. You might as well have some ones who are doing some good things too, and who are really getting out there and motivating their people to do the right thing.
Absolutely. And I think what goes for celebrities also can be extrapolated to us, right? Because as I mentioned earlier in the show, I think this rollout is one of the biggest science communication projects in history. And I think we all have a vital, vital role to play, no matter, what our background is, what our community is. We all have a part to play. So, so as part of this, we have a campaign called Vaccine Boosters, and as part of that, we're going to train, all of y'all and anyone who wants to partake, how to have these important conversations and difficult conversations sometimes around vaccines, because so that we can be an ambassador in our community. So we would love for all of you to take part in that. The first training session is going to come soon. So we'll drop in the comments a link on how to sign up so that you can be notified. Awesome, awesome. And, as part of this also, we're going to make sure each week on the show, we're going to give you one prompt on something to share on social media, because I think it's important that we keep this conversation going, every week, every day, as much as possible. So every bit really counts. So our prompt today is, why are you excited to get the vaccine? Please use the hashtag vaccine boosters and post it on your social media channels, and we'll amplify and keep that conversation going. Rachel, why were you excited to get the vaccine?
Well, I was excited to get the vaccine, first of all, because I would love to be able to see my grandparents and my friends again, but also because as a medical student, and I go to school far away from here, I've been stuck home since March. I need to go fly back to med school at some point, and I did not feel comfortable making that cross-Atlantic trip unvaccinated. So I feel a whole lot safer now. I'm going to be in a hospital. And I mean, I personally feel a lot better now.
Yeah, that's awesome. And I'm excited, just in general with the vaccine. I work at, one of the largest medical centers in New York. And I remember last March how terrifying everything was, but particularly for our frontline workers, right? They were dealing with a lot. There was a lot of unknowns. There were worries about were they getting enough protection, basic surgical masks even, there was a lot of lack of, those protections. And now, all of the people I work with who are doing amazing things, they're all vaccinated and they all can do, they can all do their jobs with less fear. And that's really been an amazing part of seeing this rollout happen is, all of these people who are on the front lines, having that protection.
It's weird.
From last year.
It's weird, and I know it sounds so cheesy, but I do actually feel like a superhero every time I get vaccinated. I just feel like I have this shield put up against me. I mean, no matter what I'm being vaxxed for, if it's flu or HPV or COVID, whatever it is, I do actually feel like I have this protective shield in front of me now.
Yeah, and likewise, whenever I see someone says, I got vaccinated or my grandmother got vaccinated, I just feel like, cheering and sort of clapping and sort of hollering with them as much as possible. Usually you sort of reserve that for birthdays and sort of big job announcements or something like that. But I feel every day I see in my timeline or people I talk to saying, I got the shot. And I don't know, there's just this burst of energy I get every day from, seeing people, yeah, exactly, get the shot. And, we're all part of this important collective project in sort of helping and protect each other. And it's so great to have, after a year of having not a lot of agency, to have things that we can do to protect each other. Well, we've had things that we can do, but this is one of the most effective things that we can do. And so I'm so excited that, we're at this point.
Yeah, and It's so much fun to see everybody else getting excited about it too. I mean, I've been excited about vaccines forever because it's kind of my field, what I've studied, but it's really fun to see people from high school and, people I haven't seen in so long getting really excited about their own vaccines. I'm like, oh my God, that's amazing, you guys.
Yeah, absolutely. And with that, we're going to wrap up the show today. So thank you all for all your amazing questions and participating. We'll keep doing this every week as, you know, we go through this rollout and the pandemic, because it's really important that we keep the conversations going. We keep sharing information with each other because knowledge is empowering, and we keep helping each other become better science communicators, because as we say, this is something that we can do to help protect each other at this moment in time. So we need to help each other. So yeah, thank you, Rachel, for joining us. I'll see you later. Yeah, thank you. And thank you to the audience and all the science marchers out there. We will see you very, very soon. Y'all have a good night.